Low blood pressure, also known as low blood pressure, is a medical condition in which blood pressure is too low and causes abnormal symptoms such as dizziness, fainting, nausea, fatigue, difficulty breathing, and blurred vision. How low is it compared to blood pressure? Within certain limits, the lower your blood pressure readings, the better. There is no specific number at which daily blood pressure is considered too low, but anything below 90/60ths of a millimeter of mercury is considered low blood pressure. Hypotension refers to a condition where blood pressure is too low. This condition is benign as long as no symptoms indicating lack of oxygen are present. How is low blood pressure treated? Treating low blood pressure usually begins with determining why it occurs. Low blood pressure will usually get better on its own if your healthcare provider can treat the cause directly. For example, low blood pressure may occur due to injury or bleeding. Repairing the injury and replacing lost blood with transfusions will stop low blood pressure as long as injury repair continues. If you take medications that affect your blood pressure, your healthcare provider may change your dose or have you stop taking the medications completely. If the cause is still a mystery, it is possible to treat it yourself. However, treating low blood pressure is only possible if there is a treatable underlying cause. What medications and treatments are used? The most important thing for doctors treating low blood pressure is finding and correcting the underlying cause. Treatment options range from simple IV fluids to antibiotics, surgery, or heart transplant. Some people with low blood pressure require hospitalization. Direct treatment of low blood pressure usually occurs in one of three ways. Increase blood volume, also known as fluid resuscitation. This method involves injecting fluids into the blood. Examples include intravenous, IV, fluids, plasma, or blood transfusions. Constrict blood vessels. Just as there are drugs that lower blood pressure by relaxing the body's blood vessels, there are also drugs that have the opposite effect. Changes in the way the body processes fluids. The kidneys are responsible for maintaining the body's fluid balance. Certain medications may help low blood pressure by causing the kidneys to retain fluid and salt in the body. If your healthcare provider diagnoses low blood pressure, you can advise to change diet. Increasing your salt intake can often help increase your blood pressure. Teach them how to recognize and respond to symptoms. Knowing what low blood pressure feels like is one way to help avoid problems. Your provider can teach you what to do when you feel it starting. How soon will I feel better after treatment? Depending on the cause of low blood pressure, it may improve with treatment. In some cases, it may take a few more days or weeks of medication or other treatment to help you feel consistently better. How can I lower my risk of low blood pressure? It is generally not possible to reduce or prevent the risk of low blood pressure. The only exception is avoiding situations or actions that may lower blood pressure, such as taking recreational drugs or supplements, herbal remedies that may lower blood pressure. Eating fewer carbohydrates and smaller meals may help prevent low blood pressure after a meal. What happens if you have low blood pressure? What you can expect if you have low blood pressure depends on the cause and whether you have symptoms. If there are no symptoms, low blood pressure is unlikely to be a problem. If symptomatic, low blood pressure can interfere with your ability to stand up, perform self-care, cooking, driving, and many other activities. That's why understanding low blood pressure and following your healthcare provider's instructions is so important to minimize the impact this condition has on your life. How long does low blood pressure last? How long this condition lasts depends on the cause. If you develop low blood pressure due to normal aging, it will probably be a lifelong problem.